Welcome all. We are just starting in a minute. Thanks for joining again. We're just starting the live session on YouTube and we'll be starting in a minute. Thank you. Right. So welcome again. Today we'll be starting the second part of the discussion. We had the first part being discussed in the last session. So just a second. Yeah. So we'll be starting with the second session of gynecological disorders. So as far as in the first session we have discussed on certain aspects, now we'll be discussing the part two. We have covered these topics in the first session. Today we will be discussing on certain diseases. So first of all, let me quickly start. See, we all know as far as the cannabis is concerned, the pain management is one of the USP of this particular herb. And we have seen in many indications, the pain management aspect is being very well managed as far as the various cannabis medicines are concerned. And same applied on the gynecological disorder. We all know about the endometriosis and the pain which patients suffer during the endometriosis. So again, there is no as such solution in terms of standard of care is concerned. We have some Ayurveda medicines and solutions, but specifically for pain management, we have seen, and in the studies also, like you can see that THC and CBD both. In fact, THC is more helpful, and the full spectrum medicines which we are using in India right now are having a very minimum quantity of THC as well. So they are helpful in the treatment of pain associated with endometriosis. And we can specifically categorize or maybe understand in three aspects the non there are various like aspects of pain, and the predominantly the three are nociceptive, inflammatory, and neuropathic. Nociceptive means like whenever there is some tissue damage, so that is related to, or that is known as nociceptive, and then inflammatory and neuropathic. So in these three kind of pain, in specifically endometriosis, research studies have proven that it is related to ECS, and in one study it has been established that elevated plasma levels of the human endocannabinoids, that is AEA and 2AG, were raised. So that means the connection is there with the endocannabinoid system as far as various types of pains are concerned, the endometriosis pathology, if we understand. So in that scenario, cannabis is helpful. It is very helpful as far as like pain management in endometriosis is concerned. And also we need to understand that endocannabinoid system is also like can serve as a target for endometriosis treatments. and especially like pain management, as we have already understood, and all the pain pathways are related to endocannabinoid system. We all know about CB1 and CB2 receptors, and we have seen that CB1 are specifically located in uterus, in other non-reproductive organs, and CB2 are available in various tissues and lungs, and in uterus also somewhere CB2 are also there. So both CB1 and CB2 are located in uterus, and in that scenario we need to understand that pain management in the endometriosis is very much significant and very much beneficial when we are talking about the cannabis or the medicines derived from the cannabis having cannabinoids and all. So in that scenario, so the linkage is specifically the reproductive organ, that is uterus, is having the presence of both CB1 and CB2 receptors. And when we are giving the plant-based cannabinoids, the plant-based medicines that are helpful and beneficial as far as the pathology and the issues are there in terms of the endometriosis are concerned. So we are using that in our clinic. We have seen that in many patients when we are, as I again always say, that whatever the standard of care you people have, along with that, if you include cannabis, we have seen in many females across the age groups, if they are suffering from endometriosis and the pain, cannabis is helping really well. There are internal medicines, there are local application. Some companies have launched rub-ons and local application products as well. So we have seen very good results in those cases also. And specifically, as I said, that surveys are showing that in general pain conditions, also in gynecological aspects, apart from endometriosis, there are so many other conditions in which pain is there. So surveys showing that women are reporting healing and improvement in numerous gynecological conditions, be it endometriosis, be it PMS related pain, be it pain during the menstrual cycle, or many other issues related to ovaries, related to cervix or vaginal issues, or many other issues are there. In any aspect in gynecology, if there is a pathology and there are symptoms related to the pain and other aspects, cannabis is very much effective. And we have seen in many studies that cannabis formulations are effective. However, limitation is there, still not that much of studies are there, but yes, we all can start practicing, and the more and more case studies, the more and more case reports we have will be an evidence and will be a document to prove that yes, they are getting benefited as far as the pain management in gynecological conditions are concerned. Second aspect we need to understand is the pregnancy and lactation. See, we need to understand one very important point. Although in many studies it has been seen that THC at a medical level, at a minimum level, at a standard dosage level is not at all harmful for anyone. We all can take that and it will benefit us in many ways. I'm not advocating again the high dosages that are present in flower and birds for the recreational aspect. That is definitely damaging. But for the medical aspect, for a minimum dose, it is helpful, by the way. It has been proven in many studies. But as far as the developing brain is concerned, as far as the fetus or the infant, young baby, till the time mother is doing the breastfeeding, we don't have any much studies as far as the long term neurobehavioral effects are concerned, and it is unclear right now, to be very frank and to be very honest. So what we have seen in the international scenarios, that till the time we don't have in fact it's applicable to all the medicines and all the drugs, by the way, which we are using. If we have found anything negative, definitely we stop and we ask not to take. Otherwise, if we are not having any sound data or any studies, till that time we ensure that it has to be prohibited. Because in past, you all know about certain historical events which we had as far as pregnancy and the drugs being used. We all know about thalidomide disorders, and many other historical evidences are there, events are there. So in that scenarios, we need to understand that first documentation and first information which is crucial is there is a transfer of THC into the mother's breast milk. We have discussed this in one session, I remember, about this aspect. Still, just to maybe mention here as well, So that is clear that in fact placental transfer is also there in the pregnant females. In both aspects, the transfer of THC is well documented that it is getting transferred into the mother's breast milk as well as the placenta also. So in that scenario, please prohibit, please avoid, and as low concentrations of delta 9 THC are also detected. And as I said, the long-term neurobehavioral effect of exposure to delta 9 THC on the developing brain is unclear. So let's avoid this and let's ensure that we should be cautious, and during the pregnancy and during the breastfeeding, please avoid all the internal um, cannabis medicines. They can take hemp seeds and hemp seed oil as a nutritional aspect, and they can take they can apply the local application products, but the internal cannabis medicines having THC should be avoided. In fact, CBD also should be avoided, to be very clear, as we have seen in the various international aspects. So please avoid that. But yes, otherwise it is very safe, pretty safe. It is one of the safest drug, I can say, in any other human beings. But at least for pregnancy and lactation, and there are so many other medicines in Ayurveda also, which we avoid during pregnancy and lactation because we are not clear. So many polyherbal formulations, in fact, always avoid because we don't know. So many patent medicines are there in the market. We generally ask them to avoid because we don't know how the herbs will behave, how the impact of herbs, what kind of impact of herbs will be there to the fetus or to the newborn baby. So that is the aspect which we need to understand as far as the pregnancy and lactation is concerned. Right. So please avoid that, and please also ensure that what sometimes we have seen is we are giving to certain couples. Like for example, in gynecological disorders, we are treating certain cases of infertility, PCOD, endometriosis, fibroids, and many other issues are there due to which they are not able to conceive. So, what we are doing is we are asking them first to get healed, get your reports done that you are healed now, and then try for your pregnancy. And in that scenarios, when you are trying and seriously looking for getting pregnant, please avoid these kind of medicines. And there are so many other medicines which we are using, like for example, a very simple medicine you all know, Kachna Guglu. So we ask them not to take in during when you are like trying for pregnancy or you are pregnant. Please avoid that. So in that way, so many medicines are there in Ayurveda, and same applies to the cannabis as well. Then premenstrual syndrome, again PMS, PMDD, these are very common these days. And the current treatment options we all know are lifestyle changes, certain antidepressants or hormonal interventions are there. But again, these treatments are not sufficient and also have negative side effects. And medical cannabis have been proven in so many studies we have seen in our clinic also for PMS, and there are very well documented research studies, very exhaustive studies have been done that it is a very effective treatment. Alternative is mentioned because the references which you are taking are predominantly from the international scenario, so they always consider cannabis or Ayurveda as an alternative, which we don't, but still it's just a language. So women health conditions, they have documented that for PMS, and the side effects are very less negligible as compared to the other options we have. So because it is very much helping in terms of the mitigation of the sleep issues, the irritability, the joint pain, and all the other symptoms which are there as far as the PMS is concerned. So on one side, the findings are that for the PMS, the symptoms associated with PMS are being very well managed as far as medical cannabis is concerned, as far as the cannabis medicines are concerned. So it has been documented and it has been researched that for premenstrual syndrome, it is a very good option as compared to the other standard of cares available. And it has been shown in the research studies, and it has been proven very effective. And again, I repeat, all these aspects and all these diseases which we are discussing, we have the standard of care in Ayurveda. We have certain medicines, certain therapies, certain panchkarma treatments to give them the healing, to give them the entire, the word I can use, cure in some diseases, management in some diseases, healing in some diseases to some extent. So there can be various resolutions for various gynecological disorders. But for all those, Ayurveda or therapies or treatments will take some time. For that some time, if you add cannabis into the stand of care, it will give their feeling. The patient from the first day will start responding to the treatment in terms of giving them the relief in the symptoms, and the patient will stay with you for few months, few weeks to few months. That is the beauty of adding medical cannabis, which we have seen in our small clinic and small practice, that yes, when we are starting this, patients are staying with us, patients are taking the medicines, patients are seeing the relief in their symptoms, and from the day one they are feeling yes, it is helping them out. Although we know that maybe cannabis to some extent is just managing the symptoms, and the actual healing and the actual improvement or the actual overall like scenarios of their issues will be managed by the other herbs or the other medicines which we are giving to them. That we need to understand, and we need to be very smart and like mature enough to handle all those permutations and combinations as far as the treatments are concerned. But still we have seen that specifically the symptom management and the healing also to some extent are there with the cannabis medicines. Now coming to certain malignancies, like if you talk about cervical cancer, so cervical cancer is the second leading cause of cancer in women due to the lack of effective treatment, and so many deaths are there. And we have seen again with cannabis, with research studies, specifically the CB1 and CB2 receptors are there in the cervical carcinoma cells lines and biopsies. They have reported extensively as far as CB1 and CB2 receptors are there. But if we talk about the effective cancer medicines in India, again the problem here is we are using the leaf extract. We are not using the flower and bud into the medicine. So if we have to reverse the cancer, definitely we need concentrated form of active and cannabinoids in the form of CBD, THC, and many other which are best available in the flower and bud to reduce the cancer, to convert the cancer cells into the non-cancer cells. Still, with standoff care, with whatever the treatments they are taking, if we add these medicines which are available in India, they will have some effect. They will have some healing effect at least to all these patients who are suffering from several types of malignancy. So my request to all of you is, please ensure that at least you are starting. If you came across any case of cancer, please ensure that you are starting because see, CBD has shown that they can decrease the invasiveness of cancer cells in a concentration dependent manner. They can heal, they can convert, they can ensure the symptoms are being healed. So AEL, for example, has shown the pro-apoptotic effects of carcinoma on carcinoma cell lines. So all these studies and all these documentary proof which we are showing you today are indicating that yes, cannabis is helpful. And but again, we can't guarantee, we can't ensure anyone that it will make them cancer free, or it will make them their body all the cancerous cells will be gone or converted into the normal cells. We can't say that right now, but yes, we can say that healing and improvement will be there. And sometimes patients are taking chemotherapies, radiation, or whatever in cancer cases, in various cancer cases we have seen. But when they're adding cannabis, the quality of life is being improved, their signs and symptoms and everything is being reduced and managed with cannabis being included along with the standard of care. And if any of your patient has the access to get the medicines from international platforms from UK, US. I recently guided two patients. Their relatives was in US. One was in US, one was in UK, in New York and in London. So they procured the medicines from there with our guidance, and now they are giving them those medicines are from flower and bud ingredient is there. So and they are seeing very good recovery as well, and their oncologists are also confirming that yes, they are recovering well. So again, as far as specifically for malignancies, for cancers, we need more advanced level of medicines in India, and we all are fighting for that. We all are trying to make government understand, and at least they should allow to do some kind of R&D first, and then the medicines at least should be allowed from the flower. But specifically, they can say that okay, you can use for onco only, you can use for cancer only. These are the cancer specific medicine, which is fine. They can have a controlled ecosystem or mechanism. But again, on this slide, I again want to emphasize that yes, cannabis is very effective in several types of cancer, including cervical cancer as well, and any other malignancies also. In fact, whenever patients are having cancer treatment. And the pain control, the appetite stimulation, anxiety, insomnia, nausea, all these can be very well managed by cannabis. Specifically, patients are coming to us for the pain management. Specifically, patients and oncologists are referring patients to us for their appetite issues, their insomnia issues, and all. Nausea is very common after chemotherapy cycle. So they can use that as well. And very important line, by the way, that many use non-prescribed cannabis and medical cannabis in West. A significant number in this group have also reported an ability to decrease opioids usage with cannabis as an adjunct. So the point is, the opioid analgesics and other harmful painkillers are being decreased significantly when cannabis has been introduced or cannabis has been added to the treatment protocols. So that is a very, very important aspect, because the problem is, again, on one side they are facing the harsh or the strong medicines which are there in chemotherapies and chemo cycles, and they have these side effects. And on top of that, if we are also having opioid analgesics, so the side effects will be aggravated, and the side effects will be uh, having more intensity. Rather than helping them out, it will make more trouble for them. But on the other side, if we are using cannabis, so the pacification of the side effects along with the pain management, both aspects they can see, as far as the and if we are having good quality and good ratios of THCs and CBDs, so they all, third benefit is, they are also reducing the cancerous cells, and they are converting the cancerous cells into the non-cancerous cells, and also they are inhibiting the non-cancerous cells to getting converted into the cancerous cells. All these informations which I am sharing with you are being well researched and documented as far as the medical cannabis is concerned. So that we need to understand again, that yes, there are four-dimensional aspects. Again, I repeat, to summarize, there are four-dimensional aspects of using cannabis. One, again, to manage the side effects. Second, to specifically having the pain management. Third, to ensure that the cancerous cells are getting converted into non-cancerous cells. And fourth, the non-cancerous cells are not getting converted into cancerous cells, so the spread of cancer is being checked. So all these aspects, first is checked, then is reduced. All these aspects are being seen as far as the cannabis medicines are concerned, with respect to the cancer care. Let me just take the questions. Let me just quickly complete, and I request all of you to post questions. And as we will complete the discussion, this talk, we will definitely take the questions from all of you. Then menopause is again a very, very common issues these days. To young females, we have seen it is coming now in late 30s and early 40s, very common. And menstrual cramps, PMS, endometriosis, all these are there with other females. And with menopause related symptoms also, we have seen that cannabis is being shown that it is benefiting. And the one very common symptom is insomnia, which I also get complaints from uh, premenopausal. I think it's some spelling mistake, so it's premenopausal or perimenopausal also. Yeah, in one case it can be perimenopausal. So we have seen that very common symptom, and we all know that cannabis is very helpful in insomnia. And then survey based studies also conducted that cannabis alleviates certain menopause symptoms, such as sleep problems, as I said already, insomnia, then irritability. Like, see, we need to understand, when a female is going through the menopause, so they are not happy, and cannabis is proven to make you happy. So that is also very important finding, which we need to understand. Then depression, joint pain, and some will definitely have hot flushes, vaginal dryness, bladder problems. All these are very common issues. And so in those issues, not, I'm saying not in all the issues cannabis is effective, but especially the sleep issues, the mood swings, depressions and all, and joint pains, it has been shown very effective solutions are there. We have other herbs, by the way, for vaginal dryness. We are using so many herbs for bladder problems and other issues in Ayurveda. So again, as I said, in a combination, that what we are doing is, we have specific 2-3 formulations which we are using in females who are suffering from menopause, and along with that we are adding cannabis to that. So it helps us in taking their journey in a better way through this very critical stage of their life, and ultimately they are having less issues, and they are able to maintain their life in a better way. So again, we have to just manage this. We can't avoid this, or we can't maybe kind of a having any permanent solution for this, but until the time it will be completed, we have to just manage the things. That is the treatment protocol as far as menopause is concerned. So again, when you add cannabis to these cases along with whatever the stand of care you are having in Ayurveda, it will definitely give you very good results. And from the day one, I remember a couple of cases. One lady came to me around 43 years of age, and she was not able to sleep, and her mood swings are very high, and she was again very much irritated, frustrated, negative thoughts, and all these aspects were there. And when we realized that she is going through her menopause, and there were some like family or personal issues were also there, so we started some Ayurveda medicine. Along with that, we started cannabis, and from the day one, she called me next day that I was able to sleep, and overall, like I'm feeling better now from the day one. So that kind of aspects we have seen as far as menopause, female suffering from menopause is concerned. And the second case I remember specifically, she was having typical joint pain in all the joints and multiple joints in the like knee joints, ankle, and we have gone through all the reports. In fact, initially we were not having that idea. So we checked, there was no OA, RA, or any uric acid elevation or anything was not there. But when we realized that, again, when we have taken the history, we realized that she was suffering from menopause, and due to that, these kind of pains are happening. And then when we started cannabis along with the stand of care which we are giving in menopause with Ayurveda, so we have seen very good healing, and ultimately she was fine without any joint pain and all. So we have seen in our clinical practice also, what is written here is a like reference from a research, but we have seen in our clinic also that these kind of issues we can address, and we can manage with cannabis along with the other Ayurveda medicines. So one very interesting piece of information is that women expectation of how cannabis could help their symptoms have an effect on the efficacy as well. So means like whatever the potential benefits are there as far as the cannabis is concerned, so it will also ensure that the women which are looking for the relief are like not having any side effects, are not having any negative effects out of that, and the expectations are uh, in that way that the effect is shown in the their healing as well. So and when we educate them, and there are so many strong evidence, and when we see this in the global research studies and all, so that confidence and that faith also works. So researchers concluded that medical cannabis might heal, and it's not might, in fact I can sure and I can rest assured that it will definitely heal. And the best part is there is no negative consequences, like for example in stand of care, the hormonal medicines or whatever the medicines they are giving, they have so many negative consequences, dependencies, and sometimes we have seen other side effects due to those medicines, which is not in the case of cannabis medicines or any other herb or plant medicine for that matter. So that is, I think, the main USP or the main aspect which we have seen in our cases, and that is a very crucial and significant aspect which we need to understand as a clinician as well. And when we convey this to the patients, and when we convey this with their faith, with their confidence, with a reflection of our knowledge, of our attending these kind of sessions, discussions, and all these exercises are like for this only, that see, you all are very much aware, you all are very much learned professionals. We are just creating these kind of platforms to convey this information, this these references which you all of you can also see and study and have a brief idea. It's just we are practicing a bit more right now. Maybe you all can grow and practice more than us in some time, and we are just correlating that clinical experience with the research findings we have in the public domain. So that is the only effort which we are doing, which we all need to understand, and accordingly as a team we all need to grow and take it forward. Pelvic condition, again, chronic pelvic pain, CPP, is very important and very significant issue these days, increasing very rapidly, in many patients. And in one study, when patients were using cannabis, so 5.9 point reduction in pain score, very, very significant amount of reduction in the pain score have been seen. And also those patients who have not responded to, in fact, this is a very complicated disease. Many times all the treatments are getting failed when we are treating CPP. Many times the standard painkillers, the highest level of painkillers, are also not effective as far as the and by the way, in cannabis, as we have already discussed, on one side it is acting as a painkiller, on the other side it's also healing the root cause sometimes as well. So again, in chronic pelvic pain, it can be one of the very like good option and effective option for treating chronic pain. So, and it is safe, as we all know, one of the safest options. So I also request all of you to advise your patients who are suffering from CPP as far as getting them onto the medical cannabis, because it will definitely help them, it will definitely improve and reduce their pain. From the day one you will start getting the results, you will start getting the feedback from the patients that yes, they are able to get relief in whatever the pain issues they were having. And as I said, that there is not much standard of care treatment options are available and working in CPP cases. So in that scenarios also, you need to understand and need to advise them as well, right? So that was all from my end today. As far as certain gynecological conditions were there, there are so many diseases and so many other issues. I don't want to maybe right now discuss, just to give you some brief idea about all these main diseases which we are dealing in our clinics. But yes, there are so many other diseases. It's not the complete gynecology we have correlated or understood as far as these two sessions were concerned, but predominantly those having the highest amount of research, those having the highest amount of, you can say, references in our clinic as well as in the public domain, we thought to compile. So those who have missed the first session, go to our YouTube channel. You right now many of us are seeing on the YouTube channel, so you will get a link there. You can see that first session also, and after that you can refer to this. And those who have joined late, maybe you can rewind and see after the session we conclude. We have few questions. Let me just get some questions right now, and all of you can now ask and let us know if you have any questions. We can discuss that. So there is one question, sir, can we give this oil to our patient having dysmenorrhea every day, or only when they start getting pain some days before or during the periods, to consume it once or twice in a day, depending on the intensity of pain? Okay. So the question is, Dr. Maria wants to ask that if we have to give it to the patient daily, or it's like just when they are experiencing the pain, then only we have to give them during the periods or before after the period. Now, Dr. Maria, the answer is, see, we need to first of all understand the pathology, why they are having dysmenorrhea, why they are having pain. So if there is some pathology, there is some, for example, so many patients we have having PCOD or ovarian cyst or uterine fibroids or any other pathology in their ultrasonography report. They have hormonal imbalance or whatever. So in those cases, we have seen that yes, when we treat the pathology, then the pain is also getting healed. So for that, definitely we have to give that for the entire duration with the standoff care. For non-idiopathic or for any pain, any dysmenorrhea where pathology is not being established or we are not able to understand, but we know that symptom is there in terms of pain during the periods of during the menstrual cycle or before and after as well. At least I request for 3 months continue, and because there can be inflammation, there can be tissue damage, there can be some neuropathies involved, there can be any other reason due to which the pain is there. So at least for 2 to 3 months you can give actively to those patients as well. And after that it can be SOS also, that whenever they have pain, and many like these days products are external or local application products as well. Sometimes in some cases we have seen that if there was no pathology and it was an idiopathic, or we are not able to connect or correlate any reason, any specific reason, and pain was also till mild to moderate level, not that much of acute, so they have taken only during the pre or post or during the cycles, during the time when they were having pain, and they were fine in 2 to 3 months. They were having a significant improvement, or sometimes they are applying the local application oils and all only, they are not taking internal. And after that also within 2 3 months we have seen that after applying locally as well, the patients are getting improved and the pain is getting decreased to a very significant level. So all these findings till now we have in our clinic, and I again recommend that try to connect any pathology in your patients, and if you feel that yes, there is a specific reason, then maybe you can accordingly connect and prescribe. Otherwise, SOS is also one option which you can have. Right, again, any other question? Just let me check the YouTube as well and WhatsApp also if there is any question. Right. So I think there is one more question about the dosage. See, dosage, again, we have done an exhaustive session. Now, as far as these gynecological conditions are concerned, the gynecological conditions which we have understood till now, same, the dosage will be on the same pattern which we have discussed in the previous session of dosage indications. I think Dr. Maria, you have joined again. So I have answered your question. You can maybe refer to the YouTube link and see the answer which we have just discussed about your query. I think you got disconnected. Right. So the dosage is, the dosage is again the same pattern which we have already discussed, but to be very specific in gynecological disorders, you can have a bit higher dosage because it will help in healing the reasons also sometimes. Specifically, like for example, we are using in PCOD, fibroid, cysts and all. If the normal standard dosage is 6 drops or 8 drops, we are giving 10 to 12 drops sometimes to ensure faster healing and quick healing, and pain management is also there. Then always have internal as well as some external local application products also along with the internal one. VJ75 capsules or Chilokia Vijayavatis are like 2 BD or 2 TDS maximum. VJ75 1 BD or 1 TDS maximum you can use. As far as the tablets and capsules of Ananta is concerned, I think Vikram is not there today. Maybe he's busy. And tinctures, as I said, the drops which we have understood in one session, you all can refer to that session. The link is available on our channel, and you can go through the entire dosage mechanism which we can have. Still, if you have any specific query, please ping us on one-to-one basis, and we will ensure to address that as well. So on that note, I again thanks all of you. We have launched a couple of projects recently. I request all of you to connect with us on Monday 3 p.m. Zoom. We are doing the orientation session of 100 Crore Club. We have recently launched on our platform. Please go through our Facebook page, our LinkedIn or our Instagram, and you can have the understanding on that. And we are also proceeding towards a very big event in May, that is India Hemp Expo. And I request all of you to get involved. We will have several conferences, several sessions, and many things there as well. So all of you are invited to get involved as well. I think Vikram has joined recently. So maybe Vikram, quickly you can share your inputs. And we were discussing about the gynecological disorders. I would like to have one query from you guys, that I thought there was somewhere in discussion that you people are also planning, or I don't know. I'm just lost that communication. I think there was some local application product as far as the gynecological disorders were there. So connect me if I'm wrong. That is there anything in pipeline with you guys?
Yes, Dr. Saab. I'm really sorry. I had some emergency. I was not able to join,
No problem.
but I am here. Yes, recently, we have launched a new product for menstrual cramps. It's a roll-on product. It's a topical application product which has been formulated. And going forward, we are also coming out with this menstrual cramp tincture for.
This sorry to interrupt you. This local application product which you have launched, can you just share some brief like details, that what is the quantity, how much is the cost to the patient, and what kind of ingredients are there in that product?
Yes, sure. So this product which you launched is a very handy product. It's a 10 ml roll-on. The MRP of the roll-on is 249, and the contents in this is of course the extract from the hemp leaf. We have hemp seed oil, we have nargundi, we have wintergreen oil, thin oil. So these are the key ingredients for this. We and the moment we have launched the product, we're getting some very good feedback and very good inquiry for this product. For the And going forward, we'll be also launching some tinctures which are going to be for oral use and other products for typically gynecological disorders. I believe that it is a big problem also, and we get a lot of queries for this. And and in our clinical trial phase also, by end of the year, by end of this year, the third trial we want to do is actually on menstrual cramps only. So we are taking this problem very seriously, and we hope that the products we are bringing in are able to help and benefit maximum number of people.
Great, great, great. Thanks for this update. I think definitely this is a very important uh, medicine or product, I will say, as far as the gynecological disorder management is concerned. So thank you so much again for joining. It was a really nice session and interaction with all of you. We are looking forward to have you on another Saturday next week at 3 p.m. and we'll definitely share the topic and in well like prior, so that all of you can manage. I think in last few sessions we were having some issues. I was personally was not able to join, but from next week onward, let's have fix at 3 p.m. every Saturday. We'll be doing this session, and accordingly we can take it forward. And thank you all for joining, and have a great weekend ahead. Thanks.
Yeah. Thank you, Dr. Saab, and thank you as always. We will be bringing the next session. I would like to thank all the doctors who joined today, and sorry for my not being able to join early today. But we would like to see you all on next Saturday, and like Dr. Saab said, we should be sharing the topic very soon.